Well, in today's Health Alert, new research is helping us understand food allergies and why they occur. Data from nearly 3 million children shows that by age 6, as many as 1 in 20 may develop a food allergy. Researchers identified major and minor risk factors that could explain. So here to help us is our chief health editor, Dr. Partha Nandi. And Doc, what did this research say?
Yeah, it's important stuff, right? This is one of the largest reviews we've seen on childhood food allergies, and it looked at studies across 40 countries and analyzed more than 340 potential factors. And here's what researchers found. The strongest risk factors start early in life. Babies who develop eczema in their first year have 3 to 4 times the risk. Antibiotic use in the first month of life was another major factor, increasing the chance up to 4-fold. And kids with nasal allergies have 3 times the risk. And wheezing or asthma symptoms also double the odds. Delaying the introduction of common allergens like peanuts, eggs, or nuts beyond the first year raises the risk about 2.5 times, and having allergic parents or siblings also doubles the likelihood.
So the review ruling out some things we thought may have been factors for years. What were those things?
I think it's important, right? So here's what they didn't find increased the risk of food allergies: low birth weight, birth after 42 weeks, partial breastfeeding, household income, and even a mother's diet or her stress during pregnancy. It's great that they've narrowed down these key risk factors, but what about, why about 5% of U.S. kids develop food allergies by age 6 is still quite complicated. Researchers describe it as a quote-unquote perfect storm, with genetics, skin health, gut bacteria, and the environment potentially interacting all together. However, they don't fully understand how these factors work together yet. So what can we as parents do, right? Well, the strongest prevention strategy is the early introduction of allergenic foods. So around 4 to 6 months, when babies are developmentally ready for solids, introducing infant-safe forms of eggs, dairy, peanut-containing foods, and other common allergens may actually lower the risk. In fact, early peanut introduction can cut the risk of peanut allergies by up to 80%. So that's huge. So listen, I think it's a big problem, especially for kids. And so we can, if we follow some of these techniques, maybe reduce them.
All right, well, that would be good. Yes, thanks so much, Doc.
Of course.
Appreciate the research.
Of course.
This week on the Dr. Nandi Show, Dr. Nandi discovers the hidden struggles of fibromyalgia, a condition that causes musculoskeletal pain and fatigue. Tune in Saturday at noon right here on 7.